So this study looks at the 100 and specifically the injury surveillance within it. So I'm sure we've all heard of the 100, but just a little bit of background on the tournament. It's a brand new franchise cricket that got introduced in England and Wales in the 2021 domestic season, and it involves 8 new men's and 8 new women's teams across city-based. And they compete in a round-robin style competition with then an elimination and a final match. And importantly, the men's and the women's competition have a very same or similar match scheduling, which is really exciting, or it is for me at least. Key differences compared to our traditional formats of cricket are that a traditional over of 6 balls is replaced with a set of 5s, which is 5 balls, and that a bowler is allowed to bowl 2 consecutive 5s if they want to at one point, which is quite a key difference compared to our traditional formats. And there is a limit to 20 balls per game that a bowler can bowl. And obviously, given the name, there's 100 balls involved, which in the domestic England and Wales setting is now the shortest form of cricket that is played there. So why do we need to look at the injury surveillance within the 100? Well, if we go to the injury prevention literature, and specifically the sequence of prevention model, for example, we know that our injury surveillance is the first step towards preventing injuries. And especially in a new format, we don't know what the injury profile of those injuries are going to be in our men's and our women's cricketers. And as I was saying earlier, in the 100, it's very nice that we've actually got the first opportunity to directly compare the rate of injuries between the men's and the women's game, which has been traditionally quite hard with different number of games played between the men's and women's, a different scheduling, different number of recovery days, and specifically in the men's with obviously the multi-format, they're played across different times of the season as well. So that's a really exciting thing that the 100 allows us to do. So it's a fairly simple study, firstly to look at what actually is the injury profile within the 100 for both the men's and the women's players, but then also to compare to see if there's any differences between the incidence and prevalence of injury between the men's and the women's competition. So how we've done this, so we've took the first 3 years of the competition, so the 2021 to 2023 years, and this included all the men's and women's players from the 8 franchises that consented to the study. So on average, this was 149 men's players per year or per competition, and 130 women players per competition. We collected the injuries and illnesses respectively, and this was done through the collection of medical complaints by the team doctors or team physiotherapists at all the franchises. So with it being a medical complaints, this includes injury, illness, time loss, non-time loss, match training, injuries. It collects the whole spectrum. And what we've done with that data is we calculated 2 different incidents. So firstly, we calculated a tournament injury incidence, which is per 100 players per tournament. And we calculated a match injury incidence, which was per 1,000 days of play and per 1,000 player days. So we can allow that comparison to what is published in the literature, whilst also conforming to the consensus statement as well. And the third and final thing that we calculated was a tournament injury prevalence, so showing the percentage of players unavailable on any given day of the tournament. So what did we find? When we looked at all injuries together, so both time loss and non-time loss, in the men's competition, we had roughly 37 injuries per 100 players per tournament, and in the women's, this was 33. So quite similar between the two, no differences noted there. When we broke that down into time loss, we found roughly 10 injuries per 100 players per tournament in the men's and around 8 within the women's. And again, no differences noted between the men's and the women's competition. And when we looked at the non-time loss injuries, again, we saw a similar rate between the men's and the women's competition and around 27 injuries per 100 players per tournament in the men's and around 25 in the women's. What we did find when we compared the rate of time loss and non-time loss injury incidence was that the non-time loss incidence was significantly higher than the time loss during the tournament. To touch on injury prevalence, what we found was that roughly around 3.6% of men players would be injured on any given day of the tournament, and this was slightly less, although it wasn't different in the women's competition, and around 3% of players unavailable on any given day of the tournament. So we split that data down to see where these injuries were happening. So we've got along the bottom there whether they're happening in matches, in what format of training, or if it was an illness. Unsurprisingly, we found the majority of time loss and non-time loss injuries were occurring in the match, which is what we thought. And the rate of time loss and non-time loss was higher than cricket training, gym training, and other activity, which wasn't a particular surprise. But again, what we did find is we found no difference between the men's and the women's competition. And we also broke it down a little bit further, so where in this cricket-specific action were these injuries happening, and was it in matches and was it in training? So this is just looking at the time loss incidence, and we found that in both competitions, fielding was resulting in the most of the time loss injuries, which is slightly different to what we may have thought. And when we broke it down into non-time loss, again, we found fielding was the majority of injuries, with also in the men's game, our batting non-time loss injuries in matches were quite high as well. But again, following a general theme, we found no differences between the men's and the women's competition. And finally, we broke this data down into where in the body were these injuries happening by body region and body location. So in the pink part of the graph, we have the time loss incidence. So our highest time loss incidence was in the lower limbs for the men's and the women's competition. Whereas when we looked at the non-time loss instance in the green bar, it was the upper limb in both the men and the women's competition that resulted in the highest non-time loss incidence. And the body locations that were, the specific body locations that were most injured, so firstly looking at the time loss instance, in the men's competition it was the thigh injuries, which we're increasingly seeing with our white ball teams, and that is to be the highest injury instance by body location. And in the women's competition it was hand injuries, as the previous study also found in women's. And in both competitions the highest non-time loss incident was hand injuries. And finally, just quickly reporting on the match injury instance, we found no difference between the men's and the women's competition. And we can compare that to our T20 and our one-day cup from the study done by Luke Goggins a couple of years ago. And when we looked at the men's compared to the men's T20, we found a significantly higher rate of injury in the 100 compared to T20. But when we compared it to the one-day competition, we found a similar rate of injury. Unfortunately, we don't have the same level of data from our women's game, so we had to compare it to the men's game, and what we found was that the women's 100 presented a similar risk of injury to both the T20 Blast and the men's one-day cup. So just to summarise all of that, what did we find? Well, we found a very similar injury profile between the men's and the women's competition. We think there's quite a few different factors for this, some of them being that the same match scheduling, the same training scheduling, and the same number of recovery days might play an influence on that. We found that match fielding was associated with the highest time loss and non-time loss incidence, which is what we're increasingly seeing with our T20 analysis as well. That could be due to the emphasis of preventing boundaries, preventing single runs, trying to get batters out more, which results in a higher intensity in our fielding. And we found that the men's 100 appeared to have a greater risk of injury than T20, but less than one day, whereas the women's compared to our men's T20 and one day had a similar rate of injury as well. And just to comment on that first point again about the similar injury profile, the men's and women's team also had the same level of medical care between them, which has been thought to influence the recorded injury rates as well, which may be another factor influencing that as well. But underpinning all of this, of course, we have only got the first 3 competitions in there. We need to keep analysing from our injury surveillance programme to confirm these findings, and that this is actually the injury profile that we're going to see year on year. So just to finish up, nice and short for you, I'd just like to thank all of the franchises, all of the medical staff for all their continuing help within the injury surveillance programme, as well as all the authors and everyone else at the ECB as part of this project. So thank you very much and more.